Hello, my name is Kyle Koshalek, a research coordinator through the National Farm Medicine Center. Alongside Kate Barnes and Dr. Casper Bendixsen, and in collaboration with the Upper Midwest Agricultural Safety and Health Center, I will be presenting the Rural Firefighters Delivering Agricultural Safety and Health, RFDASH, and our exploration in expanding the program beyond its regional borders. So as the program has grown over the years, so has the team. The program has a lot of moving parts, and with that, it requires a vast amount of knowledge and expertise, as you can see here. To give you all a quick background on what RF-Dash is, as many of you know, agriculture is one of the most dangerous industries, and there is an inadequate number of safety consultants to help farmers make their farms safer. Through a pilot study, farmers expressed increased willingness to make changes to behavior and operations if they are given advice from their local fire departments. This led to the development of the RF-Dash training program, which is designed to equip rural firefighters and EMS with agricultural health and safety knowledge in their service areas, as well as improve farmers' access to capable farm hazard analysis. So the trainings typically that we have last 8 hours. 4 of those are in the classroom, and 4 hours are implementing what they had learned at a local farm. The program content consists of 5 modules. First module is Intro to Ag Emergencies, which raises awareness of the rates and reasons why agriculture is dangerous, identifies major causes of farm injuries, and lastly, that prevention is possible. Module 2 is Pre-Planning and Mapping Farms with Farm Mapper, and this is an interactive web tool that provides emergency responders on-site information about hazards and physical layouts of agriculture operations aimed to make responding to emergencies on farms safer. Module 3 is also another web tool for farm hazard analysis with saferfarm.org, and this is a simple method for evaluating and recommending corrections for hazards in agriculture. Module 4 is Farm First Aid, which helps bystanders to an agricultural incident, a type of workflow and response that is used until emergency responders can arrive. The fifth and last module is reaching out to farming community, and this helps with fire and EMS to basically find the best ways to approach and build trust in relationships between responders and farmers. So since the trainings began in 2017, we've trained over 70 trainers, primarily in the Midwest and New York, and they have begun to go out and train others and implement their own versions of the program in their communities. So I'll give a quick background on how the national training came to be. Initially, the project, as I mentioned, for targeted fire and EMS in the upper Midwest. However, after a fire department in New York had reached out to the RF-Dash team and requested a training there, as well as the strong interest and responses we had already been receiving in the Midwest, we decided to expand the program and conduct a national training. So by conducting the training, we wanted to explore and see if RF-Dash was generalizable enough for use in other regions and to try and increase partnerships between stakeholders. So back in early September of 2019, we invited 18 individuals from various regions around the country. And this included Washington, Idaho, Utah, Minnesota, Wisconsin, Nebraska, Ohio, Pennsylvania, and New York to travel to Minneapolis, Minnesota and take the 2-day RF-Dash trainings. We had many participating fire and EMS partner up with a local ag safety and health specialist in their state. And this was done to encourage partnerships between agricultural health and safety professionals, as well as collaboration after the training was done. 2 of the 18 participants were National Fire Protection Association representatives, or NFPA, and what we've been told by many firefighters is that the NFPA is considered like the Bible of fire departments. And what the NFPA has been doing for over a century is they've been creating codes and standards that have focused on eliminating hazards to reduce injuries, fatalities, and loss of property. So the training consisted of participants engaging the 8-hour training for the first day, and then going through the 5 RF-Dash modules, and then applying the lessons learned at the local farm by mapping out the farm and assessing and scoring hazards. So we also held a roundtable discussion on the second day, discussing how to cement emergency responders as the key connectors to their local agriculture communities, ways to improve the program for both of our target audiences, and lastly, a discussion on how to best fit RF-Dash into current NFPA standards or develop new ones to better include agriculture and prevention practices. So through the roundtable discussion that we had on the second day, participants had expressed their thoughts on ways to better improve the program. And this included looking into ways to improve branding of the program to create a clearer identity for both firefighters and EMS, as well as farmers. The need for the program to live beyond the grant cycle by focusing on methods and tools to help with sustainability. Looking into amending the National Fire Protection Association NFPA standards. And lastly, providing an online presence for the program. So the outcomes that we've been working on since then is that we've been working with a marketing company, Broadhead, which has helped us redefine and present the program more effectively to our target audiences. You can see some of the work that's been done with an example below with the new logo for the program at the bottom of the slide. We've also been focusing on sustainability as we are currently in development of a training manual that will help prepare and encourage development of tailored regionally specific versions of the program. We'll be also looking into ways and methods to merge RF-DASH into current NFPA standards. That will be hopefully a major driving force for rural fire and EMS departments to seek trainings, increase their knowledge of agricultural hazards, and to acquire additional funding to support agricultural injury preventions. Most specifically, we'll be looking into the 1300 standard, which discusses community risk assessments and community risk reduction plan development, and then that would hope to better fit agriculture health and safety applications. We'll be looking at also setting up a dedicated website that will offer easy access to the program's courses, as well as additional training support and a location for participants in RF-DASH to connect. And lastly, we are currently doing follow-up interviews with participants from the national training in regards to their responses and experiences to the training, as well as what have begun to apply the program in their rural communities. So, a majority of the nation's fire departments are volunteer-based and serve a vast amount of our agricultural communities. Firefighters and EMS have received the program with tremendous enthusiasm and shared it via their injury prevention and public education services. By targeting firefighters and EMS, community-based agriculture health and safety interventions can scale up and apply best practices in agriculture health and safety. The implications of the RFDASH program for ag safety and health is leveraging firefighters and EMS to connect with the area farmers and improve health and safety practices on farms. In addition, the program increases safety of first responders to agricultural incidents. I want to give an acknowledgement to our funding through this 5-year grant funded by the Upper Midwest Agricultural Safety and Health Center, or UMASH, as well as through a cooperative agreement from the National Institute for Occupational Safety and Health. To learn more, you can visit the rf-org project website for additional information and resources. And I also want to mention that I have no conflicts of interest to report. I want to thank you for taking the time to listen to the progress of the RF-DASH program. If you have any questions, you can email me at koshalek.kyle@marshfieldresearch.org, or you can also reach out to any of the project team members.